Hello everyone, so we can start the session. This is the Grand FMGE December 2021 session, Anatomy Quiz Part 4. Anatomy Quiz Part 4. Okay, so let's start with the session now. My dear aspirants, so here we will discuss the anatomy quiz. So today I have taken the Part 2, the Part 3 and the Part 4. The first part is done on 18th October. Those who want to see all the sessions, they can start seeing the session. And tomorrow I will take the Part 5th session. So you can just see the session there. So yes, let me know, can you hear me and is the screen clear? Okay, so let's start the session now. So myself Dr. Monalisa, and I have done my MD Anatomy from Armed Force Medical College, Pune. So when we are talking about the free live classes on the Unacademy platform, you can access my free live sessions by downloading the Unacademy app. तो सबसे पहले आपको Unacademy app को download करना है Play Store से. Then you have to find your goal as NEET PG. You have to find your goal as NEET PG. Okay. Thereafter, what you have to do, you have to find your goal as NEET PG. Thereafter, you have to directly go for my session if you have got a link, because the links will be shared in Let's Crack NEET PG and INICT Unacademy group of the Telegram group. Then you have to use the code ANAC10. So you can use the code ANAC10 and you can unlock the session and you can be the part of this session and you can see the sessions absolutely free on the platform of Unacademy. I also want to tell you about the free special class features. What are the features of free special class on the Unacademy platform? So many important points are there for the special free sessions of the Unacademy. The first thing is that it's an interactive session where the learners can interact with the top educators of Unacademy platform. You can respond to the poll for a better understanding of the topic. Talk to an educator live when the session is being held. Raise your hand and have the conversation done. Never miss a session. So what happens if you start watching the session, what you can do, you can follow the educator on the Unacademy app, and then you will not be able to miss any of the session, because you will get the notification of all the session taken by the educator. After finishing the session, you can download the lecture notes. PDF notes can be downloaded, and this is the extremely beneficial point about the special platform, about the platform of Unacademy. Anytime, anywhere, read from the top educators of Unacademy platform. My dear students, I also want to tell you about the Plus subscription of Unacademy. What are the benefits of Plus subscription? When we are talking about the Plus subscription, all the 19 subjects will be covered up in a very systematic way. You can watch the free sessions and also the recorded versions of it. Study on the device of your choice. Learn from India's top educators in the medical field. Assess more than 25,000 MCQs of all 19 subjects. Complete the test and the live quizzes and be prepared for your weak areas and have a revision of that weak areas, and printed notes of the Unacademy with the subscription of 1 year and more you will be provided with. So these are the benefits of the Plus subscription. Avail this opportunity, that is extremely beneficial for you. I also want to tell you about the Iconic subscription. What are the benefits of Iconic subscription? When we are talking about Iconic subscription, you get the benefit not only of the Unacademy, but also you get the benefit of Prep Ladder. So two important best platform in the medical field is collaborated together. So you can assess the benefit of both this platform. Already discussed about the benefits of the Plus subscription. I also want to tell you about the Prep Ladder benefits, where you can have all the clinical integrated essentials, video lectures of the Dream Team, QBank 3, rapid revision snapshots, and Treasure and Dream Notes 2021. All these can be assessed by you in the Iconic subscription. So just grab this opportunity. Use my code ANAC10 and get 10% discount. So by using the code ANAC10, you can get 10% discount. I also want to share this slide. So in this slide, you can see a comparison has been done from the NEET PG Iconic and the Plus platform का comparison किया गया है, where you can see the benefits of Plus. In this benefits, many of the benefits of the Iconic subscription is added on. So either you can go for 1.5 years, 2 years or 3 years of subscription on 4 years. You can see the demo live sessions when you are watching the special free sessions, and you can compare this session and just go for it. Okay, so use my code and get 10% discount and just go for this subscription. It is extremely beneficial. I also want to tell you about the updated highly effective QBank or the question bank of the Unacademy, where you can assess more than 25,000 MCQs. This is highly effective. Clinical questions can be assessed by you based on the latest pattern of examination, includes a detailed explanation for each and every MCQs. Use the code ANAD10 and get 10% discount. Use the code ANAD10 and assess 10% discount. Boost your medical preparation by taking the subscription either of 2 years or 12 years. In any of the subscription, use my code and get a 10% discount. VV Associate, good evening dear. So I also want to tell you or inform you about the free monthly grand test series on the platform of Unacademy, that is for the INI-CT 200 MCQs, FMG 300 MCQs. FMG का free test है 31st October को, morning session 10 AM. If I talk about INI-CT free test, free test which is occurring on the Unacademy platform, this is consist of 200 MCQs and this is going to take place 2 to 5 AM on 24th of October. So please note down the date and just grab the opportunity and use my code ANAD10 to get enrolled for this free test. I also want to share the free test for NEET PG 22 aspirants. So the students of NEET PG 2022 aspirants, what they can do, they can join the 23rd October free test, and this 23rd October free test is going to happen from 2 to 4. Okay, your name is Joseph. Okay, very nice dear. Okay, yeah, from Hyderabad. Okay, great one. Okay, so raise your hand and get your doubts cleared. Okay, this is extremely beneficial for you. I also want to share congratulate the students who have cracked the NEET PG examination with a high rank and a good mark. So I am very glad to share their images with you so that you can get a boost of preparation. And also I want to tell that you can be also the toppers. Just the thing is that be dedicated to your study. Okay, Osmania Medical College, great. I am very glad to associate with you, Mr. Joseph. Okay. So let's start with the session. Let's start with the first MCQ for today's session. All the best. All the best. All the best. So this is the first MCQ. Mark the answer. Okay. So yes, question number 1. All of the following is correctly applied to internal thoracic artery except. So, which statement is correctly? No, which statement is correct for internal thoracic artery? So, A, B, C, D, 4 options are there and you just tell me the correct answer. Which of the following statement is most correct statement about internal thoracic artery? It runs posterior to transverse thoracic muscle. It ends in 6th intercostal space. It divides into superior and inferior epigastric artery. It gives rise to posterior intercostal arteries. 4 options are there and you have to mark the right answer. So your time starts now. I will give you 15 to 30 seconds for marking the correct answer. Which statement correctly applies to internal thoracic artery? Question number 1. Statement correctly applies to internal thoracic artery. Okay, your time starts now and mark the correct answer for question number 1. Okay, so let me give you the correct answer. Don't worry if you are not confident about the answer. I will explain it. So actually the correct answer is B. Why? Because it is ending in the 6th intercostal space and dividing it into terminal branch. So in the 6th intercostal space, it is dividing into terminal branch. Its 2 terminal branches are superior epigastric and musculophrenic arteries. I would like to tell that the question number, the option 1 is not right, because after the 2nd costal space, in the past 2nd costal cartilage, the internal thoracic artery is running anterior to transverse thoracic muscle. So, after descending to the second costal cartilage, the internal thoracic artery is not running posterior, but it is running anterior to transverse thoracic muscle. So, please note down this point, this is very important. And the termination is occurring in the sixth intercostal space, which was given as an option, and it divides into two of its terminal branches. One is superior epigastric and other is musculophrenic artery. So, superior epigastric and musculophrenic artery, these are the two terminal branches. These are the two terminal branches. Which is at the level of sixth intercostal space. Now, see here, I just want to show you this diagram. This is the internal thoracic artery, branch from the subclavian artery. After that, what you can see, it is descending down. So, can you see here, it is descending down, and this is the first, second, third, fourth, fifth and sixth. This is the sixth intercostal space in which it is dividing into two terminal branches. One is superior epigastric and other is musculophrenic artery. So, musculophrenic artery and that of superior epigastric arteries are the two terminal branches. Now, here musculophrenic artery is given in the 7th, 8th and 9th intercostal space, and it is also giving the intercostal arteries from 7th, 8th and 9th. So, actually when we are talking about the internal thoracic artery, it is giving anterior intercostal arteries. It is giving anterior intercostal arteries. The branches which it gives is anterior intercostal arteries. Okay, anterior intercostal arteries. The branches given is the anterior intercostal artery, not the posterior intercostal artery. So, here the option which was provided, as you can see in this, the option which was provided was, it is giving rise to posterior intercostal artery is absolutely wrong. Actually, it is giving a rise to anterior intercostal arteries, and it is dividing into not inferior but superior epigastric. So, the most correct answer is B. So, the most correct answer is B. Now, let us move on to question number 2. Which of the following is a saddle type of synovial joint? Which of the following is a saddle type of synovial joint? Whether it is sternoclavicular joint, whether it is Manibro-Sternal joint, whether it is interchondral joint, whether it is intervertebral joint or costochondral joint. So, okay. So, we have got 5 options and you have to give me the right answer. Question number 2, mark the right answer. A is sternoclavicular joint, B is Manibro-Sternal joint, the third is interchondral and the fourth is intervertebral or costochondral. So, according to you, which is the correct answer? Which is the saddle type of synovial joint? So, mark the answer, and actually I would also like to give you the clear explanation for all type of these joints. Yes, you are absolutely right, Joseph. It's a branch from the first part of subclavian artery. You are absolutely right. Yes, absolutely right, correct. Now, come to the question number 2. Write question number 2 and give me the right answer. Which is the saddle type of synovial joint? Which of the following is saddle type of synovial joint? Your time starts now. Mark the correct answer. So, Nidhi Chauhan has given the answer. What about others? Nidhi Chauhan has given in the answer. What about others? Okay, which of the following is saddle type of synovial joint? So, I am getting answers. Okay, sternoclavicular joint. So, absolutely right. All of you are absolutely right that saddle type of synovial joint is sternoclavicular joint. Yes, absolutely right. You all are absolutely right. But what I want, okay, which of the following is saddle type of synovial joint? So, my dear aspirants, let's move on to the all options and just give you a description of all the joint. So, sternoclavicular joint is a type of saddle type of synovial joint. Sternoclavicular joint is a type of saddle type of synovial joint. The articulation between the sternal end, this is the sternal end of the, so see here, this is the sternal end of the clavicle. This is the sternal end of the clavicle and this structure is the manubrum sterni. So, this is sternum का manubrum है. So, articulation between the manubrum sterni which is forming the sternoclavicular joint is saddle type of articulation. Now, what about the costovertebral and costotransverse joint? Actually, when we are talking about the costovertebral joint, it is an articulation which is between the head of the rib and the adjacent body of the thoracic vertebra. Okay. So, costovertebral joint is an articulation between the head of the rib and the side of the corresponding two adjacent vertebrae. So, this is plain type of synovial joint. When I am talking about costotransverse joint, it is also an example of plain type of synovial joint and it is the articulation which is happening between the neck and the tubercle of the rib. So, see here, costotransverse joint is an articulation between the neck and the tubercle of the rib and the transverse process of the corresponding thoracic vertebra, transverse process. This is also the type of plain type of synovial joint. This is also the example of plain type of synovial joint. Now, coming to the costochondral joint. Next is costochondral joint. So, when we are talking about costochondral joint, it's an example of primary cartilaginous joint and it's an articulation between the ribs and their cartilage. So, articulation between the anterior end of the rib and their corresponding cartilage is an example of primary cartilaginous joint and there is no movement occurring in this joint. Costochondral joint is an example of primary cartilaginous joint. Now, coming to costochondral joint. Costochondral joint. So, when we are talking about costochondral joint, the costochondral joint is an articulation between the rib and the cartilage. As you can see in this diagram, this is the bony rib and this is articulating with this cartilage. So, junction between the corresponding rib and their cartilage is an example of costochondral joint. Now, chondrosternal joint. So, it is important that the concept of each type of joint is clear to you because I have seen many of the students get confused with in the thoracic region joint. So, chondrosternal joint. Next is chondrosternal joint. Chondrosternal joint again is an example of plain type of synovial joint and actually it is an articulation between the medial ends of the bone, that is first, second, third, fourth, fifth and sixth, with the lateral border of the sternum. The other name of chondrosternal joint is it is also called as sternocostal joint. Sternocostal joint. It is also called as sternocostal joint. First chondrosternal joint is primary cartilaginous joint, that is synchondrosis. Absolutely right, Joseph. Yes, true ribs. So, it is an articulation which is seen in the true ribs with that of the lateral aspect of the sternum and the bone, ribs. And this is again an example of primary cartilaginous joint, that is synchondrosis. Now, coming to interchondral joint. When we are talking about interchondral joint is the articulation which is seen in between the 7th, 8th and 9th costal cartilage. Can you see here, this 7th, 8th and 9th. Okay, these 7th, 8th, the lower ribs, that is except that of the floating ribs, is articulating with each other with a smaller joints, so they are interchondral joint. These joints are called as interchondral joint. They are also small synovial joints. Now, Manibro-Sternal joint. Next is the Manibro-Sternal joint. So, Manibro-Sternal joint is an articulation between the body of the, between the lower end of the Manibrum sterni and the body. This is the body of the sternum and this is Manibrum sterni. So, articulation between Manibrum sterni and the body of sternum is an example of Manibro-Sternal joint, and it's an example of symphysis or secondary cartilaginous joint. Secondary cartilaginous joint. It's an example of secondary cartilaginous joint or symphysis. Now, when I am talking about the articulation between this lower aspect of the body of sternum and that of the xiphoid process, this is called as Zippy sternal joint. Zippy sternal joint. This is Zippy sternal joint. So, when we are talking about the Zippy sternal joint, the Zippy sternal joint, if I talk about this, functionally Zippy sternal joint is an example of, can anybody tell me? Zippy sternal joint. Functionally it is an example of synarthrosis, and anatomically or structurally it is an example of, so structurally or anatomically it is an example of synchondrosis. So, please note down, Zippy sternal joint is structurally synchondrosis and functionally synarthrosis. All of you can write down this joint and particular type of joint, because this is commonly asked in the examination. Now, coming to the next topic, that is intervertebral joint. So, what do you mean by intervertebral joint? Intervertebral joint means the articulation between the bodies of the corresponding vertebrae. So, between the bodies of the vertebra, we have got again secondary cartilaginous joint in the midline. So, articulation between the bodies of the vertebra is secondary cartilaginous joint, and articulation between the process of the vertebra. It is an example of zygapophyseal joint, that is plain type of synovial joint. Articulation between adjacent bodies of the vertebra is an example of secondary cartilaginous joint, and articulation between the articular process of the vertebrae is again an example of zygapophyseal joint, plain synovial joint. So, see here in this diagram you can clearly see the articulation between the adjacent vertebrae. It is an example of secondary cartilaginous joint. Intervertebral disc is lying there, as you can see here. In between we have got intervertebral disc. So, in brief we have done the important joints. Now, let us move on to the next MCQ, that is MCQ number 3rd. All the best. Artery of ductus deferens arises from. What is the origin of artery of ductus deferens? Artery of ductus deferens arises from aorta, inferior epigastric, inferior vesical, pudendal or common iliac artery. Artery of ductus deferens arises from which of the following? It's the aorta, it's the inferior epigastric, it's the inferior vesical, it's the pudendal or common iliac artery. Your time starts now. Mark question number 3 and give me the answer. Krishna has given E as the answer. What about others? The correct answer is, so those inferior vesical artery. Artery to ductus deferens is an example of inferior vesical artery. And inferior vesical artery is a branch of, anybody? Inferior vesical artery is a branch of anterior division of internal iliac artery. It is a branch of anterior division of internal iliac artery. Artery of ductus deferens arises from inferior vesical artery, which in turn is a branch from anterior division of internal iliac artery. Now, I want to show you this image where you can clearly see artery of ductus deferens arises from inferior vesical artery. This is the internal iliac artery, anterior division of internal iliac artery giving superior inferior vesical artery, which is again giving rise to artery to ductus deferens or vas deferens, which is clearly mentioned in this image. Yes, now moving on to the next MCQ, that is MCQ number 4. Which of the following structure passes through the triangular interval of the arm? Which of the following structure is passing through the triangular interval of the arm? Whether it is radial nerve, whether it is axillary nerve, whether it is median nerve or ulnar nerve. Which is your answer? Question number 4, mark the correct answer. Question number 4, mark the correct answer. Which of the following structure passes through the triangular interval of the arm? Arm. So, please mark the word arm. Arm. Close to the triangular interval of arm. So, the hint is triangular interval of the arm. So, what is the correct answer? So, yes, Mednair has also joined triangular interval of the arm. Arm. It's the word arm, not the shoulder joint or axilla. So, the correct answer will be radial nerve, triangular interval. When we are talking about axillary nerve, it passes through quadrangular interval. Please note down, the correct answer is, so axillary nerve passes through the quadrangular space. Yes, Desert Prince is absolutely right. If we are talking about the word arm, it's the triangular space, and that triangular space is giving the structure traversing is radial nerve, not the axillary nerve. Axillary nerve passes through quadrangular space. Let me just, no worry, it happens. So, let me just give you once more that explanation of the spaces. So, can you appreciate there is one quadrangular space and there is two triangular spaces. Okay. So, let me just highlight this. So, this is the quadrangular space, this is the upper triangular space, and this is the triangular space. Okay, no worries, I am here to explain. See here, this is the quadrangular space, this is the lower triangular space, and this is the upper triangular space. What has been asked? Close to the arm means in the MCQ they are asking about the lower triangular space. So, the structures traversing through lower triangular space is one artery and one nerve. Okay. So, the structures traversing is the nerve is radial nerve RN and the artery is profunda brachii artery. Profunda brachii artery. Okay. This triangular space is bounded by long head of triceps, shaft of humerus, and superiorly by the teres major muscle. Quadrangular space is having the boundary. Superiorly we have got the teres minor space, as you can see here. So, we have got teres minor space superiorly, lower down we have got teres major space, medially long head of triceps and laterally surgical neck of the humerus. The structure traversing through quadrangular space is one artery and one nerve. So, what is the name of the artery? The artery here, so quadrangular space से axillary nerve pass करेगा और जो nerve axillary nerve, so structure passing is axillary nerve and the artery is posterior circumflex humeral artery. The artery is posterior circumflex humeral artery. Now, through the upper triangular space just one artery passes, just one artery. Which is the artery dear? The artery is circumflex scapular artery. The artery is circumflex scapular artery. So everyone, can you appreciate all the structures? So all of you do revise this. This is very important for your MCQ session, that you should know all the structures traversing through the 2 triangular space and the 1 quadrangular space. Absolutely right, Joseph. So see here. So this was the MCQ which has been asked. Let me just write the important points, which is very important. Please don't get confused with these points. Upper triangular space. Upper triangular space say circumflex scapular artery. Can anybody tell me circumflex scapular artery is a branch of which artery? Lower triangular space, radial nerve and profunda brachii artery. Quadrangular space, the structures through quadrangular space is subscapular. Absolutely right. Subscapular, third part of axillary artery, subscapular. Absolutely right. Absolutely right, dear. Yes. Now quadrangular space से axillary nerve pass करता है और the artery is posterior circumflex humeral artery. Posterior circumflex humeral artery. So I think, is it okay? Everyone has revised it. No worries. Everyone has revised it. Let's move on to the next. That is question number 5th. Duodenojejunal junction is supported by the attachment of which of the following? Duodenojejunal junction is supported by the attachment of which of the following? Suspensory ligament of duodenum, that is called as ligament of Tris, falciform ligament, hepatoduodenal ligament, greater omentum and transverse mesocolon. Question number 5th, mark the correct answer. Duodenum jejunum junction is supported by the attachment of which of the following? Suspensory ligament or the falciform or transverse mesocolon, greater omentum. So Mednayer has given his answer. What about others? So yes, Mednayer has given absolutely right answer. Suspensory ligament of duodenum, which is also called as ligament of Tris. It's a ligament which is supporting the duodenum and jejunum junction, and superiorly it attaches to the diaphragm. So I would like to show you this diagram. See here. Here you can clearly see this is the junction of duodenum and jejunum. From here, the attachment of ligament which is shown here is the suspensory ligament of Tris, and this suspensory ligament of Tris attaches from the duodenum-jejunum junction, and superiorly it merges with the right crux of the diaphragm. So it is not letting the duodenum-jejunum junction to sag down. Got it, everyone? So absolutely right. A was the absolutely correct answer. Let's move on to the next. That is question number 6. All the best. See here. Which of the following statement is correct? Question number 6. Which of the following statement is correct? Which of the following statement is correct? Spinal cord is enlarged in the thoracic region for innervation of upper limbs. Spinal cord is enlarged in the lumbosacral region for innervation of the lower limbs. In embryo, spinal cord occupies only superior 2/3 of the vertebral canal, and in adults, spinal cord occupies the full length of the vertebral canal. 4 options are there for question number 6. Mark the correct answer. Your time begins now. Question number 6. Mark the correct answer. Actually, we have to pick up the right answer. So here the correct answer is, anyone wants to answer? Dyer, absolutely right. Spinal cord is enlarged in the lumbosacral region for innervation of lower limbs. Yes, absolutely right. Actually, in the cervical region, in the lumbar region, it get enlarged for the cervical region, not the thoracic region. In the cervical region, it will form brachial plexus. Here, it will form lumbar plexus to give innervation to lower limbs. So, B option is absolutely right. The A option is wrong. In embryo, it is occupied. So, in the embryo, it is occupying not the superior 2/3, whole of the length in the embryo for till the 3rd month of intrauterine life. In adult, full length is absolutely wrong. It ends at the level of L1 lower border, lumbar vertebra. So, let us see one by one the option. It is enlarged in thoracic region, absolutely wrong. It is enlarged in the cervical region to innervate the upper limb, brachial plexus के formation होता है. Lumbosacral region, it will form the lumbar plexus and it will get innervated to the lower limb. So, this is absolutely correct. See this diagram where you can nicely see, this is the cervical region where you can see the cervical enlargement. In the lumbar region, you can see the lumbar enlargement for innervating the lower limbs. Now, in embryo, it occupies the superior 2/3 of the vertebral canal, is absolutely wrong. Actually, till the 3rd month of intrauterine life, the whole length is corresponding to each other. Then this vertebral column is growing at a faster rate, but till after the baby being born also, it will end at the 3rd lumbar vertebra. In adults, it will end at the L1 lumbar vertebra. So, let us see this. In case of adult spinal cord, can you see here? In case of adult spinal cord, it is ending at the lower border of L1. In case of infants, it is ending at the upper border of L3 lumbar vertebra. Okay, yes, lumbar puncture clinical importance is that you can take the sample and you can go for CSF examination. So, that is diagnostic purpose. Therapeutic purpose is that we can also go for lumbar puncture for giving spinal anesthesia in case of painless operations to be conducted in the pelvic region, or in case of we can also pierce and we can reach the epidural space and we can go for epidural anesthesia for painless vaginal delivery. And lumbar puncture is both therapeutic and diagnostic. Diagnostic का मतलब हम fluid निकालेंगे CSF and we will go for the examination of CSF fluid, whether it is meningitis, which type of meningitis, bacterial, viral, tuberculosis के कारण तो meningitis नहीं हुआ है, fungal तो नहीं है. So that examination can be investigated. The other is we can go for lumbar puncture for providing spinal anesthesia. Okay, Joseph. Now coming to the question number 7th, relations of internal capsule. Relations of internal capsule. Thalamus is lying medially, caudate and lentiform nucleus laterally, thalamus laterally, caudate and lentiform nucleus medially, thalamus caudate nucleus medially and lentiform nucleus laterally. So, please read all the 4 options and give me the right answer, which is the best answer, dear. So, yes, I am just seeing your messages. So, question number 7th and write the answer. Which is the best answer for question number 7th? Relations of internal capsules are so yes, answers are coming up. So Joseph has told C. Thalamus, caudate nucleus medially and lentiform nucleus laterally. So absolutely right. Yes, thalamus and caudate nucleus is lying medially, and we have got L for lateral and L for lentiform nucleus which is lying laterally. I would like to show you a schematic diagram where you can have a look on this diagram and understand this. So what you can see, this whole area which you are seeing here, this is the internal capsule. And you can appreciate the relations of internal capsule. See here. Here you can appreciate this whole is the internal capsule, which is an example of projection fibers connecting the cortical and the subcortical region, and it is exactly residing. Here you can see caudate nucleus and thalamus. These two structures is lying in medial relation of the internal capsule, and this lentiform nucleus is lying laterally. So in between the caudate nucleus and the lentiform nucleus is the anterior limb. In between the thalamus and lentiform nucleus is the posterior limb, and this bend part which you are seeing is the genu, which is exactly lying between anterior and posterior limb. Sublentiform part is the lying below the lentiform nucleus, and retrolentiform part is lying behind. Retrolentiform nucleus is lying behind the caudate nucleus, the lentiform nucleus, sorry, the lentiform nucleus. So absolutely right. So let's move on to the next, that is which of the following is a false statement about subclavian artery? Which of the following is the wrong statement about the subclavian artery? On left side, the subclavian artery arises from arch of aorta. On right side, arises from brachiocephalic trunk. Vertebral artery arises from the second part, divided by scalenus anterior muscle into 3 parts. Question number 8, mark the correct answer. Yes dear, absolutely right. That is optic and auditory radiations are related. Yes, absolutely right. Retrolentiform and sublentiform. Yes, absolutely right. Sub and retrolentiform is again related with the visual and that of auditory radiations. Absolutely right. Okay, question number 8, mark the correct answer. Wrong statement is C. Absolutely right. Vertebral artery is a branch which is from the first part of subclavian artery, not from the second part. Yes, so the correct answer for question number 8 is C. All other options are absolutely correct. When we will see the origin of subclavian artery, on the left side it is arising from arch of aorta, on the right side from brachiocephalic trunk, absolutely correct answer, and divided by scalenus anterior artery into scalenus anterior muscle into 3 parts. Now let's see this image. So this diagram will clearly, this diagram will clearly show you the branches of subclavian artery. So here you can see the subclavian artery first part. First part branches are thyrocervical trunk. This is the thyrocervical trunk, the vertebral artery, internal thoracic artery. Can you see here? These 3 branches is the branch from the first part. So these 3 branches which has been shown here, thyrocervical trunk, the internal thoracic artery and the vertebral artery are the branches from the first part. These are the branches from the first part of subclavian artery. Second part is the costocervical trunk. Also the branches from the thyrocervical trunk has been shown. The branches from thyrocervical trunk, which is the branch from the first part of subclavian artery, is inferior thyroid, transverse cervical and suprascapular. We have also got the costocervical trunk, which is a branch from the second part of subclavian artery. Second part of the subclavian artery giving branches deep cervical and highest intercostal arteries. Third part, dorsal scapular arteries. Now let's move on to the question number 9th. Very good. Nice attempt. Let's move on to 9th. Circle of Villus does not get contribution from which of the following arteries? So circle of Villus, as we have discussed, another one MCQ in which we have seen the location. We have seen that it is located in the inferior or the basal aspect of the brain in the interpeduncular cistern. Now, the next MCQ which is targeting here is the formation of circular villus. So, its formation is from all of the following artery, but one of the artery which is given in the option is not contributing the formation of circular villus, which is the right answer. Your time starts now. You will get 30 seconds for marking the correct answer. Okay, so question number 9, circular villus does not get contribution. So yes, we have the answers are coming up, and B is given as a right answer, and all of you are absolutely right. Yes, it's the middle cerebral artery is not contributing, absolutely right. The middle cerebral artery is not contributing in formation of circular villus. It's the internal carotid artery. Yes. How to prepare for the first Prof examination. So now the time is, if I talk about to Joseph, so now the time is there where you have to concentrate for the theory part and the practical and the Viva examination. So just start preparing 10 years question bank of your own university, and try to make as much as diagrams you can make by your hands, and just practice the long questions, short notes, important topics. So I come up with few of the first year students also anatomy session. So I will have a revision session. I will let you know. You can join. Yes, lot of syllabus, but we can finish it with a quick revision or rapid revision kind of thing, where we can have an interaction with the theory and the practical examination. So there you can do, only the thing is revision and concentrate on the most important topics. Now you have got 2 months, 2.5 months for your university exam, I think, and just go through all the university question papers, and also MCQs are important, so go on revising the important topics. So I will have a session, will let you know in Let's Crack NEET PG platform, and also on the group of INICT Unacademy group, Telegram group. Okay. So middle cerebral artery is not contributing. Now let me show you a very nice diagram where you can appreciate. So let me slightly highlight this diagram. So this is how the circle of villus is formed. So yellow color pentagonal shaped structure which you are seeing is the circle of villus formation. So what you can see here, the formation of circle, posterior cerebral artery is posterior boundary for the circle of villus. Posterior communicating artery is posterolateral boundary. It is the posterolateral boundary. It is the posterolateral boundary for the circle of villus. Internal carotid artery is laterally bounding. It's the lateral boundary. Anterior cerebral artery. Can you see here? It is forming anterolateral boundary. Anterolateral boundary, got it? Anterolateral boundary. And anterior communicating artery is the anterior boundary. It's forming the anterior boundary. So what is important, that the name of all the arteries along with its part and contribution. So posterior cerebral artery is forming posterior boundary. Posterior communicating is posterolateral boundary for circle of villus. Laterally internal carotid artery, anterolaterally is anterior cerebral artery, and anteriorly is anterior communicating artery. So you can write it also if you want. Quickly we can write, so that if in examination also it comes, you should know this. This is very important for MCQs also. So write down circle of villus. So circle of villus formation. Already we are knowing that it is located in the subarachnoid cistern, that is interpeduncular cistern. Anterior boundary, anteriorly it is formed by anterior communicating artery. What about posterior boundary, dear? Posteriorly it is bounded by posterior cerebral artery. What about anterolateral boundary? Anterolaterally by anterior cerebral artery. What about lateral boundary? Laterally it is bounded by internal carotid artery. What about posterolateral boundary? Posterior communicating artery. So my dear aspirants, you can clearly see that middle cerebral artery is not contributing. So all of you can see here, this is the middle cerebral artery and you can see it is lying outside, it is lying outside the circle of Villus, outside the circle of Villus. So this is quite clear in this image. Yes, so middle cerebral artery is not contributing and most of you have given the right answer and the correct answer is B, middle cerebral artery is not contributing in formation of circle of Villus. Absolutely right everyone. So can we move on to question number 10? This diagram is very easy to understand the formation of circle of Villus. So let's move on to question number 10th. All the best for the 10th number question. Thank you. Let's move on. We have done with the formation. Okay. Which of the following is true in respect to ciliary ganglion? Which of the following is true in respect to ciliary ganglion? Which of the following is the best true statement about ciliary ganglion? Sympathetic fibers synapses in the ciliary ganglion. Afferent fibers from the iris and cornea passes through the ganglion. The ganglion is located between optic nerve and the medial rectus. Parasympathetic fibers are lying in the ganglion and are derived from the 7th cranial nerve. Parasympathetic fibers in the ganglion are distributed to the retina and the lens. 5 options are there and please tell me the most correct answer and the most true statement regarding ciliary ganglion. Your time starts now. You will get 30 seconds for marking the correct answer. Okay. So mixed bundle of answers are coming up. Mixed bundle of answers are coming up. Okay. So you have to know the location, you have to know the fibers. Actually, the correct answer here is B. Why? I will tell you. Parasympathetic ganglions are distributed to retina, no, and lens, no, that is not correct. Sympathetic fibers, synapses, no, it's the parasympathetic fibers which is synapses, not the sympathetic fibers. Afferent fibers, yes, we know that dilator pupillae, sphincter pupillae and sensory innervation to cornea, all these fibers, so sensory, parasympathetic and the sympathetic, all these fibers are passing through ciliary ganglion. Only parasympathetic fibers which arises from Edinger-Westphal nucleus is relaying here. The sympathetic and sensory fibers are not relaying here, but they are supplying, giving innervation to iris and cornea. So B is absolutely correct. C is wrong. Why? Because it is located between optic nerve and not medial rectus, that is lateral rectus. So C is wrong. It is located in between optic nerve, optic canal and the lateral rectus. Parasympathetic fibers in the ganglion are derived from 7th cranial nerve is absolutely wrong. Actually, parasympathetic is derived from 3rd cranial nerve, that is oculomotor. It is related to oculomotor nerve, not the 7th. So only B option is most correct. So if we have to choose one, we will go with B option. My dear aspirants, I want you to show an image where you can clearly see the parasympathetic, sympathetic and that of sensory fibers innervating. So see here, first thing that is very important, which is the correct statement, is afferent fibers from the iris and that of cornea is passing through the ciliary ganglion. So this was the correct answer. So this is the reason we have chosen B as the correct answer, B option. Now see this diagram. What you can appreciate here, in this diagram you can clearly see, okay. So in this diagram you can see 3 fibers, okay. So one is the sensory, one is the parasympathetic and the other is sympathetic. So let's concentrate. Let's concentrate with the green one. So the green color fibers which you are seeing, this is actually showing the sympathetic root, the sympathetic root, the fibers are arising from T1, then passing through superior cervical ganglion, forms plexus around the internal carotid artery, and it will pass through ciliary ganglion. Can you see here? It is passing through the ciliary ganglion, but my dear aspirant, it is not relaying there. It not relays. It is passing through ciliary ganglion but not relaying. And it is supplying dilator pupillae. Can you see the green color fibers are sympathetic fibers. So, it is supplying dilator pupillae. Now, coming to that of the parasympathetic. Parasympathetic fibers are arising. So, this is the root which is showing the parasympathetic fibers. Parasympathetic fibers are arising from Edinger-Westphal nucleus, which is located in the midbrain. What is the location of this nucleus? Midbrain. From here, fibers will pass along with oculomotor nerve via nerve to inferior oblique muscle, and this fibers, can you see here, this red color line is relaying. So, the parasympathetic fibers will relay in ciliary ganglion and will supply constrictor pupillae and ciliaris muscle. So, it is supplying constrictor pupillae muscle and ciliaris muscle. Now, coming to the third one, that is the sensory. So, you can see here, this is the sensory root, and the sensory root is passing via ophthalmic, via nasosensory nerve, and then giving innervation to the via ciliary nerve. It is giving innervation, as you can see here, to the eyeball. So, this is the three roots, and this sensory fibers which is passing via nasociliary nerve is also not relaying in the ciliary ganglion. So, by this image, it is very clearly seen that only the fibers of parasympathetic fibers are relaying. So, this is a beautiful diagram, and anatomically you can understand the three sympathetic, parasympathetic and sensory fibers here very nicely, and their root and their origin. I would also like to discuss this flow chart. Why I am giving this flow chart? Because parasympathetic innervation is very important. So, parasympathetic innervation, see here, it arises preganglionic fibers. So, preganglionic fibers are arising from preganglionic, when we are talking about the preganglionic fibers. So, preganglionic fibers arising from Edinger-Westphal nucleus located in midbrain, oculomotor nerve, lower division of oculomotor nerve, then nerve to inferior oblique. The nerve relay center is ciliary ganglion. From here, postganglionic fibers arises, and via short ciliary nerve, it is supplying sphincter pupillae and ciliaris muscle. Dilator pupillae muscle is getting sympathetic innervation. Sphincter pupillae is getting parasympathetic innervation. So, I think this explanation is enough for the understanding of question number 10th. Now, my dear aspirants, before ending the session, I want you to tell that tomorrow is Saturday morning. Tomorrow, Saturday morning, 10 a.m., I am taking the 5th session. Yes, I am taking the 5th session for this anatomy quiz on the YouTube. The link will be shared in Let's Crack NEET PG platform and also in the Unacademy Telegram group. So, follow that link and be present. Now, my dear aspirants, I also want to tell that use the code ANAT10 if you want to take the subscription of Unacademy, or if you want to see the free sessions. So, Saturday and that of Sunday. Saturday and Sunday is dedicated to clinical anatomy MCQs and cadaveric image session. So, on Saturday and Sunday, those who are present, they should note down that Saturday evening 6 p.m., 7 p.m. and 8 p.m. 40 minutes session, 45 minutes, and on Sunday 11 a.m. and 10 a.m. So, Sunday morning and Saturday evening 6 p.m. I am going to take cadaveric image sessions and the cadaveric image session and also the clinical MCQ session. Do join me for this session, and how you can see the session on the free sessions of Unacademy. So, download the Unacademy app, find your goal as NEET PG, and thereafter you can click on Dr.Monalisa free sessions, which is coming up on Saturdays and Sunday on the Unacademy. If you are using the platform for the first time after downloading the app, you can use the code ANAT10. Use the code ANAT10 to unlock and be present for the free sessions of mine. So, thank you. And what I want you to tell that before ending, subscribe the Let's Crack NEET PG platform. Subscribe the Let's Crack NEET PG platform. Press the like and share button, and you can download the PDF notes if you see the session on Let's Crack NEET PG. So if you see the sessions on link of YouTube session is provided in Let's Crack NEET PG platform, and special classes sessions after seeing the session you can download the PDF notes also. This is highly beneficial. So just go for it. All the best. Keep studying. Thank you so much. We'll again meet up with the new sessions on Saturdays and Sunday. Thank you. Thank you. Hope this is useful for you.